Hello everybody, my name is Maggie and I'm from Weller Health Education at Lehigh Valley Riley Children's Hospital. Today I'm back with another really great video. Today we're going to be talking a little bit about fentanyl and opioids. Fentanyl has absolutely devastated families, lives, and even whole towns. So it's really important for people to understand the dangers of fentanyl and how fentanyl is even being laced in other types of recreational drugs. All right, everybody, let's get started. All right, everybody, let's get started talking a little bit about fentanyl, what it does to our bodies, the short-term effects, and how to recognize an overdose from fentanyl as well. So what exactly is fentanyl? Because not everybody is familiar with this term that's now in the headlines, on the news. So what fentanyl is, it's a synthetic opioid. So that word you may be a little bit more familiar with. A synthetic opioid is a type of prescription pain medication. So these are things like Oxycontin, oxycodone, codeine, morphine, Percocets. Prescription opioids you typically are going to get with severe injuries. So when somebody's had a tooth pulled, when somebody's broken a bone, had surgery, that's typically when you're going to be prescribed a synthetic opioid. So it's really only reserved for people who are in very, very severe pain. It's going to be a lot stronger than things like Tylenol, Advil, those types of over-the-counter pain medications we take for things like a headache. You're not going to take a synthetic opioid for a headache. So with synthetic opioids, they work very, very well. They're incredibly strong and very, very powerful. Now, not only are they effective at treating pain, they also release a rush of good feelings in our brains. So unfortunately, they are very powerful and addictive. So when it comes to fentanyl, fentanyl is a type of opioid that happens to be more powerful than all the rest. So fentanyl is going to be given to people who are in the most severe pain, people who are at stage 4 cancers, people who've been in very traumatic injuries. Fentanyl originally, when it's given in a hospital setting, it's given very slowly and it's being monitored by doctors because fentanyl is so powerful. So fentanyl alone is 100 times more potent than morphine, a very common opioid that's been around for over 100 years, and 50 times more potent than things like traditional street heroin. So fentanyl is incredibly, incredibly strong. It takes very, very little to potentially have an overdose. So here on the screen, we have 2 vials. One of these has a dose of heroin, one of these has a dose of fentanyl. Now this picture shows what a potential lethal dose of each of these drugs is. So here's how much it would take to kill a person with heroin, and here's how much it could potentially take to kill a person with fentanyl. Now as you can see with fentanyl, it really only takes a couple of granules. It just goes to show how much stronger fentanyl is than any other drug out there in the market currently. And that is why so many people are losing their lives to fentanyl, because of how strong the drug actually is. So how does fentanyl actually work? So opioids, especially things like fentanyl, they work by blocking the pain receptors in our brains. So inside of our brains, if you decide to cut it open, take a microscope, and really look deep at it, inside of our brains, there are these cool little receivers. These receivers get messages from every single part of our body through our nervous system. Messages are being sent to it every single second of every day. It's how we perceive feeling. So it's how you feel when somebody touches your shoulder, when somebody pinches your side, when somebody tickles you. All of that is being sent through our nerves to these receivers in our brains. Now, that's especially how we perceive pain. So if you were outside, you were dancing, having a great time, and you ended up bumping your knee really hard. It hurts a lot, you're probably going to have a bruise the next day, but when you actually hurt your knee, a message is going to be sent from your knee through your nervous system, all the way up your leg, up your body, to your brain, to these little receivers. Your brain gets that message, and that is how you feel that pain in your knee. Now, when somebody takes fentanyl and other types of opioids, that opioid is going to block those receivers in your brain. So the message is being sent. That message is still being sent through your nervous system. Your knee probably still hurts a lot. You're still going to have that bruise. But that fentanyl is blocking that message from being received. So you still feel the pain, probably, but at that moment in time, you don't really feel it because the fentanyl is blocking those pain receivers. Now, this is very, very effective. It's very effective at helping people with very severe pain in the hospital, for example. Somebody who's broken bones, somebody who's been in major accidents. However, when that message is being received, not only is it blocking pain, but you also get a rush of good feelings. That is also what makes fentanyl so addictive. So short-term effects. What do you actually feel in the minutes and hours after you've taken fentanyl? Number one, you're going to get that rush of euphoria. So you remember how I mentioned that you get that rush of good feelings when you take fentanyl? You're going to feel very good in your body, very warm, probably the best you've ever felt in your entire life. And again, that is what makes it so addictive. You're going to feel that pain relief. So you're probably not going to feel much pain. You're probably not going to feel much of anything in your body. Again, that's what makes it effective for people with severe pain. But unfortunately, fentanyl is being abused on the streets for people who don't have any pain at all. Helps with relaxation, so you're going to feel very, very relaxed. You're going to feel sedated. You may even feel a little confused about your surroundings, where you are. You're going to feel very drowsy, very, very tired. Very heavy feeling is going to go over your body. You may feel a little bit dizzy. Sometimes people actually feel kind of nauseous, and especially when people are overdosing, they may vomit, and if you look at the person's eyes, the black part of their eye, the pupil, it's going to be constricted, which means it's going to be very, very small, very teeny tiny. So some facts about fentanyl. 42% of pills tested for fentanyl contained at least 2 milligrams, which is considered to be a potentially lethal dose. So that means many of the pills that are being circulated and sold could be potentially deadly in the average adult. And that is why, my friends, in life you may be tempted to try certain things once or twice. You especially may want to experiment with drugs and alcohol, especially when you all get to high school and college one day, grow up to be adults. However, when it comes to fentanyl, this is not a drug or a food item or a drink. You can try just once to see how it feels. It can truly only take a single pill of fentanyl to cause an overdose in the average adult, and especially teenagers too. So this is not something you can just try and experiment with. Many of these pills that are being sold, many doses of fentanyl, are deadly. Next, fentanyl can be injected, snorted, sniffed, smoked, or taken orally by pills or by tablets. So fentanyl can be taken several different ways. But my friends, it does not matter which way you take fentanyl. There is no one safe way to take it and unsafe way to take it, right? Any way you take it outside of a hospital setting is considered unsafe. The only people who should be administering fentanyl or taking fentanyl are people who have a prescription from their doctor or being given it in a hospital. Right? So it's not like, oh, I took it by pill, that means it's safe. Oh, I snorted it, that means it's safe, right? Any way you take it, that fentanyl could potentially be unsafe for any adult or child for that matter, right? So whether you're injecting it, you're sniffing, you're smoking, you're taking it orally, all of those are dangerous. They all are potentially deadly. Now, when it comes to injecting it, that comes with issues of its own, such as things like blood-borne illnesses from sharing needles. So that's something to consider as well. Next, 2 milligrams, the amount on the tip of this pencil you see in the picture here on the right, that can be enough to kill an average American. So like I said earlier, my friends, it takes very little to potentially cause an overdose in a human being. Very, very small amount of that drug. That is what makes fentanyl so incredibly dangerous, more than any other drug we've seen in the market the past 20 years. And there's another really big problem we have going on. This issue is fentanyl being mixed in other types of drugs. Now, I'm sure a lot of you have learned in your drug units about other types of illegal drugs. Things like heroin, things like methamphetamine, things like cocaine, other types of pill-based drugs, things like ecstasy being sold in clubs. Now, those drugs, they are dangerous on their own. A really big problem we have going on right now is that fentanyl is being mixed in and contaminating these other illegal drugs out there on the streets. Because fentanyl is so strong, a lot of drug dealers have realized, oh, this drug that I have, I can make it a lot stronger if I mix in fentanyl. So fentanyl is being mixed around. There's also a lot of contamination too. And because of that, people who are taking a dose of cocaine or a dose of methamphetamine do not know that fentanyl is mixed in. So somebody can take these different types of drugs thinking that, oh, I've taken cocaine before, oh, I've been taking methamphetamine for years, oh, I'm at a club, ecstasy can't hurt me, not knowing that fentanyl is being laced with it. And unfortunately, risking an overdose, risking hurting themselves because fentanyl is being laced with all these other types of drugs. So just know, like I said earlier, you cannot try these things even just once. You never know what's being mixed in it. The thing is, many drug dealers are not very honest. They tend to lie. So you cannot always trust them in selling you clean batches of drugs. Many people have lost their lives because they thought the cocaine that they had, the ecstasy they were taking was just one type of drug, but it turns out it was laced with fentanyl. So in 2022, 73,000 people died from a fentanyl overdose in the US. That is more than double the amount of deaths from 3 years prior. So back in 2019, you had people starting to overdose on fentanyl because the drug was starting to get very, very popular, but it's only risen since. So we've seen this huge spike in people losing their lives. And guys, most of the time it's younger people. It is young adults, people who are between 18 to 25, losing their lives to this deadly, deadly drug. I myself have lost people in my own family. Entire towns are being decimated because of these fentanyl overdoses. Law enforcement is seeing huge spikes in people abusing fentanyl, and like I said, fentanyl being laced in other types of drugs. And unfortunately, people are losing their lives to it. People are losing siblings, parents are losing their children, and children are losing their parents too. So, I want you all to know the signs of an overdose. I truly hope in my heart of hearts that you never have to see somebody overdose in your life. I hope you can go every single day the rest of your life never seeing an overdose. Unfortunately, because of how severe this epidemic is, it is important to know the signs and kind of file it away in your brain somewhere. Again, I hope you never have to see somebody have an overdose, but it's very important to know because when it comes to an overdose from fentanyl and other types of opioids, time is of the essence. All right, time is what counts the most. So, number one, a sign of an overdose: falling asleep or inability to wake up. You are shaking the person, you are trying to yell their name, you're splashing water on them, but they are not waking up. Their eyes are not really moving, they can't open their eyes, so they really are just kind of staying asleep in a way. You open up their eyes, and the pupil, that black part of the eye we talked about earlier, is teeny tiny, so small it looks like the tip of a pin. Their breathing is very slow, very shallow. They may not even be breathing at all, but especially severely slow breathing that looks abnormal. Choking or gurgling noises. A lot of times when somebody is having an overdose, they vomit. So if somebody is choking or gurgling or you suspect them having an overdose, turn them on their side. Many people pass away from choking on their own vomit from an overdose. So put them on their side so this way they're not choking to death. And then finally, their skin is very pale, almost even a bluish tinge, especially in their lips or their fingertips, right? So again, if you see any of these signs, make sure you call 911 right away. Even if you also were taking that drug, you still have to call 911. There are laws to protect people, so a lot of college campuses, for example, they really emphasize that if an entire room full of people, they were all drinking alcohol underage, if somebody was sick and had alcohol poisoning, you have to still call emergency services, right? The other people in the room will not get in trouble, right? And especially in situations like this, you have to call 911, right? It is better to call 911 because there is a way to save that person. When somebody is having a fentanyl overdose, they look like they are dead. They will be if you do not get them help. There are ways to save them. EMS, drivers, police officers, they have drugs to save them very quickly. It's called Narcan. When Narcan is administered, that person, quite literally, bounces back to life, right? So there is a way to save them, but it's all about time. If you wait too long, that person could potentially pass away. So you have to call 911 as soon as you can. And if you are somebody who's underage, call 911 and also get an adult help if an adult is nearby. Okay? But again, I hope you never have to see somebody have an overdose, but just kind of file this information away. We're putting out another YouTube video all about overdoses from opioids. So if you want to learn more about overdoses, how to prevent them, how to spot them, subscribe to our channel, and we're going to be putting out another video of that soon. So check it out. All right, my friends, thank you all so much for watching. I hope you all learned something new today. Too many lives have been lost due to drug overdoses, and too many lives have been destroyed from addiction. So I want to make sure you all are learning the dangers of fentanyl, the dangers of opioids, and hoping to make healthier choices with your lives, all right? Thank you all for watching. Subscribe to our channel. We have some really great videos coming out. I'll see you all in the next video. Bye!